Hi everyone. The presentation I will explain the genotype distribution of hepatitis C virus infection in Palestinian West Bank in the period January 2014 till May 2017. As we know that hepatitis C infection is a public health concern, and the WHO estimations suggest that around 3% of world's population is infected with hepatitis C. And the hepatitis C infection is highly associated with cirrhosis and hepatocellular carcinoma. And there are 6 known genotypes worldwide with more than 50 subtypes, which are vary with geographical regions. And genotype 1 and 4 are less likely to respond to the interferon antiviral therapy than the other genotypes. However, the eradication of hepatitis C nowadays is possible with the newly introduced antiviral drugs, and the genotype and subtype identification is very important and crucial for the clinical management of these newly introduced anti-HCV drugs. And hepatitis C prevalence in Palestine is reported to be 0.3 among a population-based survey in Palestine in 2000, and no national data are available regarding the genotype subtype distribution among hepatitis C patients. So the objective of this study is to provide a baseline data in the distribution of these genotypes in order to improve the clinical management of the disease and to encourage the Palestinian Ministry of Health for the newly introduced antiviral drugs. And we try to explore the risk factor associated among the different genotypes of the studied patients. So a cross-sectional study here is done between January 2014 till May 2017, where we include 132 patients with detectable viral load results from all Palestinian West Bank districts, and the laboratory test here done in the Central Public Health Lab in Ramallah, West Bank. The C genotypes were determined using molecular methods, real-time PCR-based assay, and the genotype were assessed according to gender, age, geographical region, patient complications, and risk factors. And the clinical and demographic data were retrieved from the Ministry of Health records. Descriptive analysis were done using SPSS software. The mean age of the studied patient was 49.9 years, while the median age was 52 years. And the graph here shows the distribution of genders from male and females with regard to percentage. And the male to female ratio was 1.2 to 1. This is the most important finding in the study, which is the distribution of hepatitis C genotype among the studied population. And as you see here in this slide, that genotype 1 and 4, followed by genotype 3, are the most prevalent genotypes in the studied, among the studied patients. This slide will show the distribution of hepatitis C genotypes in the West Bank 11 districts. And to simplify this issue, we divided the West Bank districts into 3 different major locations: the northern, the middle, and the southern geographical region. And we here determined the distribution of C genotypes among these 3 major locations. And as you will see that the 3 prevalent genotypes are distributed among these 3 different locations with somehow different proportions. This table shows the distribution of hepatitis distribution of hepatitis C in the complicated cases. And as we'll see here, that genotype 1 and 4 are mostly and distributed in 95% among the 21 cirrhotic hepatocellular carcinoma complicated cases. This table shows the possible risk factors associated with hepatitis C studied patient in regard to genotypes. And as we'll see here, that the most common risk factors associated is hemodialytic patients, intravenous drug users, as well as the blood transfusion. And to continue the table, here we have the unknown cases, which represent about 40.1% without any known of risk factors. For discussion, this is the first study to determine the prevalence of hepatitis C genotypes among the West Bank region of Palestine. And as we saw from the presentation, that the three major genotypes in the West Bank, Palestine, circulating is genotype 1, followed by genotype 4, and less commonly genotype 3. And hepatitis C genotypes distributed with different proportions on the three major West Bank locations. The prevalent hepatitis C genotypes determined are similar to other Middle Eastern Arab countries, and the hemodialysis, injected drug, intravenous drug users, and blood transfusion and surgical operations are could be the major routes of hepatitis C infection among the studied patients. The limitation of the study was the lack of comprehensive information regarding the hepatitis C patients, and not all hepatitis C subtypes were determined using the techniques. Recommendation: result can be used as a baseline evidence data needed during the decision for the introduction of the new antiviral drugs in the Palestinian Ministry of Health, and studies are needed to understand the epidemiology of hepatitis C genotypes and disease prognosis of these studied patients or hepatitis C patients with the new coming anti-HCV drugs. And at the national level, it is suggested that hepatitis genotyping assay to be systematically determined before starting the therapy. This study, I think that it represents a good collaboration between the physicians, nurses, and decision makers that contribute together in order to achieve the concept of better understanding will go to better response. So I will thanks all of these contributors and who introduced or who helped in achieving this study. And thank you all.
The floor is open. Yes, the first question there.
Thank you for your presentation. Can you read the slide for the complications?
Yes.
I wanted to ask about thalassemia and
Complication?
No, the next
Risk
one.
factors.
Yeah, thalassemia and hemophilia. How can they be associated with hepatitis?
Sorry.
Thalassemia and hemophilia. The association between them?
The association between them in
And
regard to
hepatitis.
genotypes or in the
يعني-
HCV infection?
Yeah.
HCV infection in general.
Because they receive,
So they are included in the blood transfusion. They're already included, yeah?
yeah, they are part of the blood transfusion. Yeah,
Uh-huh.
because-
So this is a combined.
Yes. The major one is the blood transfusion, and part of that is thalassemia and hemophilia.
Yes, there.
Thank you very much for your interesting presentation and this interesting topic. My question is related to the cost. Do you know the cost of the genotyping for the patient? I
It
think
is
I don't know for your country.
We get the benefit of introducing the HCV genotyping as a service in the Ministry of Health in order also to investigate this study. So it is already was introduced as a service for hepatitis C patients for, after getting any high viral load infection. We are doing routinely HCV genotyping in order to determine the genotypes, subtypes before starting the treatment.
This is my
So it is-
question. I come from Egypt, and we have a big problem with the hepatitis C in the past. Now we are making some success in treating. Is it genotyping is required to be routinely for each patient? Regarding that, I know that the genotype 4 or genotype 1 is the most prevalent one. This is my question, because you write it in your recommendation that it becomes as a routine, and I think it needs some cost effectiveness study
it
to,
is.
yes.
It is expensive, I know that. It is expensive to do the C genotyping, but it is very crucial and very important before starting therapy, because determination of hepatitis C genotypes and also subtypes sometimes with genotype 1 is very important in order to determine the dose, the duration of the treatment, as well as to predict the prognosis of the, after therapy. And also after, that FDA launched the newly drugs, the direct acting drugs.
Yes, of course.
I think they say that it is very important to determine the genotype or subtypes for C genotypes in order for the clinical management and regimen.
Thank you, thank you.
Any other questions from the floor? So I have one question, and thank you for a very nice presentation, and it's a good example of how the research can be applied to practice. If I understood correctly, now it's a practice that the genotype is done before starting the treatment for hepatitis. Excellent. Okay, thank you.
Okay.
Thank you. Thank you
Thank
for
you
your
so much.
presentation.